So this is going to be your setup for your barium enema. So I would have lubricant on your table to help insert the BE tip, okay? You can have your BE ring, and this is to help capture any barium that may come out of your patient. The easiest way to go ahead and fill this up is to just attach this to the oxygen on your wall and turn on the oxygen versus having to blow air into this, but it's kind of like an inner tube. It blows up and then the barium will be captured down in the plastic here instead of going on the table. What do you think one disadvantage would be for using a BE ring? The problem with this is if the patient is leaking out, all of the barium is going to be captured like a pool. This is like a pool. And then you'll have one big blob of white contrast on top of your patient's body because the barium is all collecting here. Okay? So I typically just have extra towels out. If I see that the patient is leaking, I will just grab a towel, wipe, and just drop it on the floor. Okay? Because it's not the time that you want to clean up your patient. It's not the time that you want to move slowly, because our whole goal is to get the patient out as quickly as possible but still get our images. All right? So you just want to take those towels, clean up as much as you can, drop it, and continue until you get all your projections done. Okay? This is the standard disposable tip that comes with the regular BE bag. We generally don't use these because it doesn't have the balloon, the retention balloon on here, and so it would be hard for the patient to hold this in, especially if they're having cramping or something like that. I also have the tape that you can tape the tubing to the patient's gluteus maximus to ensure that it's going to stay in place. Here is an example of a regular contrasted BE bag. So it comes in a bag like this. Make sure that you look for the expiration date, because if it's expired, then you have to throw that in and get another one. But the BE bag for the regular contrast generally has the powder already in there, and you load it up with warm water between 85 and 90 degrees Fahrenheit to about 1,500 mLs. You're going to shake it vigorously to make sure that it is mixed well, and then you're going to run the line to get the air out of the line, so you'll have barium all the way to the tip of the BE bag, because you'll have an airlock if you put this into the patient's rectum with the air still in here. That air that's in the tube has to go into the intestines, which is then going to take up space where the barium isn't going to be able to go. So you want to make sure that you run the line before you insert this into your patient. Make sure that you have a gown and plenty of towels and napkins for the towels and washcloths for the patient out here as well as in the bathroom. Okay? And then with your tubing, so this is going to be your double contrasted here. Your single contrast will only have the tube to blow up the balloon and the tip. Okay? So when you attach your inflator cuff here, this is going to inflate your balloon. So I always check my balloon to ensure that it works, because you wouldn't want to have a balloon that might have a hole in it. You tip the patient, and then when you go to use your inflator cuff, the balloon doesn't work. So once you insert the tip, you're going to inflate it, and then you're going to clamp it off so the balloon stays in place, and that's going to help hold. Make sure that you do one full big squeeze so that you're sealing the sphincter. Okay? If you're doing the air one is going to have the two extra tubings. Okay, the blue tube is what is going to introduce air into your patient. So you're going to have to get the blue bulb, which just attaches here, and we keep the blue bulb as well as the inflator cuff after use. We just wash that off, and we use these two devices over and over again. Obviously the tip and the bag gets thrown away after each patient. But once the radiologist comes in and he puts in the thick barium, he will then pump in the air to blow air into the intestines, and there's little holes on the tip that help to blow up the intestines. Make sure that you keep your pole 24 inches from the height of the tabletop. No higher than that, because that increases the flow rate, which could also increase the patient's cramping and spasming of the large intestines.